Co-founded by Helen Keller in 1915, Helen Keller International works by delivering the essential building blocks of good health, sound nutrition, and clear vision. The organization helps millions of people create lasting change in their own lives, working in 20 countries across Africa, Asia, Europe, and the United States, and together with a global community of supporters, Helen Keller International helps to ensure every person has the opportunity, as Helen did, to reach their true potential. In 1999, Helen Keller International began work in Nigeria with the aim of reaching under-resourced communities with life-changing eye health, neglected tropical diseases, and nutrition interventions. Over the course of 25 years, we have made an incredible impact in Nigeria by working in 23 states and the Federal Capital Territory. Today, we are operating in 11 states and the Federal Capital Territory, including Adamawa, Akwa Ibom, Bauchi, Benue, Borno, Ebonyi, Katsina, Kebbi, Nasarawa, Sokoto, and Taraba. Despite facing numerous challenges, we remain dedicated to our mission of bringing smiles to millions of families throughout the country. Our work has touched countless lives, and we could not have done this without the huge support of our partners, donors, and team members. We are excited to share our journey with you.
The organization was implementing a neglected tropical diseases program. From December 2016 was when I took up the position. And at that time, Helen Keller had three programs, but they were neglected tropical diseases programs in Katsina State and in Akwa Ibom State. But since then, I think we've grown quite a bit. Then we had only about 22 staff, but now we are in 12 states with over 100 people on our payroll. Now we've gone beyond just trachoma surgery to do what we call hydrocell surgery. For nutrition, we have quite a group or quite a nutrition portfolio, I would say. We have the Advancing Nutrition Program. We have a nutrition program funded by the Church of Jesus of Latter-day Saints, which has a mix of interventions. One of them is for internally displaced persons, while the other is targeting mothers and children. And then we also have a beyond fortification project as well, all in Helen Keller. And then we have a large vitamin A dissemination program that spans 6 states. So I am incredibly proud of the work that the team in Nigeria did and the achievements that we have had. So we went from, like I said, 2 states to 12 states, which have a joint population of over 60 million people. Every year we reach more than 6 million children with vitamin A. Every year we train and develop the capacity of more than 30,000 volunteers. And then every year we reach more than 5 to 6 million people also with neglected tropical diseases medication.
Neglected tropical diseases, NTDs. Helen Keller International has played a crucial role in leading efforts to implement integrated control and elimination activities for neglected tropical diseases in Nigeria. We collaborate with the Nigerian government to control and eliminate 5 neglected tropical diseases, such as lymphatic filariasis, onchocerciasis, schistosomiasis, soil-transmitted helminths, and trachoma.
We have people who have had, example, trachoma, blinding trachoma in Katsina. In Katsina, in the past, we had to go the same thing, house to house, in 27 local government areas, house to house, finding cases. As we speak today, we are out of Katsina doing TT surgery. We are done. And Katsina, I think, is the first state in Nigeria to have achieved this feat. 27 local government areas, all of them have been reached out and all the cases found have been operated. And we've done over 10,000 surgeries for trachoma in that place. This is what we want to see, giving back people their own life. We are there to support them to live up to their potential. And today, as we speak, these 10,000 people have gone back to their businesses. They are not going to be irreversibly blind. And this is what we try to put as legacy that Helen Keller has left in the country, in the world, and will continue to do it in Nigeria.
In our environment here, once you hear Helen Keller, it is a hell. just like Brevo. I've met a man who says for the past 20 years he has not put up a tie because he cannot wear trousers because of what is down there. I want to say a very big thank you to Helen Keller. I saw their slogan is continuing her works. We are here to support her as much as we can.
To kuma lokacin da idanuna suna damuna, gira ne yake damuwa na an kai min aiki. Na samu dace, na ji daɗi, na gode ma Allah da san rayuwata da san rayuwar mai gidana.
Additionally, over 142,000 individuals have been trained in the fight against NTDs. In our eye health programs, through a collaborative effort, over 11,000 trachoma trichiasis cases were managed. Additionally, over 6 million persons were treated for trachoma follicles using the Mass Drug Administration. These interventions have improved the health and overall well-being of individuals and communities. Every year, around 5.2 million children under the age of 5 die worldwide, and almost 45% of these deaths are caused by malnutrition-related issues. To combat malnutrition, Helen Keller Nigeria has adopted a comprehensive approach that includes providing technical and financial support to the Nigerian government and other partners to improve the nutrition of mothers, infants, young children, and other vulnerable family members. Our efforts aim to enhance the capacity of the nutrition workforce by providing state-of-the-art training and mentoring as part of food and health system strengthening.
Kuma ina zaune a gida ba aiki, to haka ne muna rayuwa kenan. Zuwan Helen Keller aka ce mana to kar mata su zauna haka, da aka kawo mana lambu. Tunda na samu masa kaɗan sai in nayi masa haka sai in gyara wurin lambuna, sai Helen Keller kuma ya sake taimake mu da jari. To sai jari na ma ya karu. Sai na saya akuya, na saya tulo-tulo, kuma suna ɗan tafiya suna girma.
Through the Improving Food and Nutrition Security and Transforming Lives project in Adamawa State, we have been able to impact almost 250 individuals directly and over 79,000 persons indirectly. The beneficiaries have so far generated and saved over 8 million naira through 11 villages and loan savings associations and income-generating support groups. Additionally, we have reached over 55,000 women with multiple micronutrient supplements, screened almost 76,000 children for malnutrition, and trained 845 health workers. This has contributed significantly to improving the health and well-being of the people in the communities we serve. Our work in nutrition is not just specific to the food and financial security of our beneficiaries, but also include the use of micronutrients as essential supplements for the well-being of mothers and children. Micronutrients play a vital role in maintaining a healthy immune system, growth and development, and overall nutrition.
Actually, the impact is very high in Nasarawa, because if I can recall back then that the Helen Keller is not in Nasarawa State. There was a particular round we could not even hold it, just because of lack of funds and support. But with their coming, we have never skipped any year. And secondly, the coverages in the past, when the Helen Keller were not there, you will see 40-something%, but with the presence of Helen Keller, we shoot to 80-90%.
In the past 3 years, we have provided almost 28 million vitamin A supplements to eligible children aged 6 to 59 months across 7 states.
Helen Keller International played a very vital role in the coordination of the bullion fortification discussion in Nigeria. They brought up the issue some 5 years ago and recommending the NFA to consider considering bullion as a vehicle for food fortification. Helen Keller plays a very big role in such coordinations, and up till now they do that.
As part of the Advancing Nutrition in Nigeria project, currently implemented in 4 states and the FCT, we focus on capacity building of health workers and agric extension workers. Our aim is to strengthen multi-sectoral linkages and coordination by providing technical assistance to the government of Nigeria and implementing partners. We also support wasting prevention and treatment services while generating evidence and testing innovative approaches to improve nutrition programming, which will inform future designs. Over the past 25 years, Helen Keller International has touched the lives of millions of Nigerians and left behind a legacy of progress. It is through the rich partnership with communities, government, and donors that we have achieved so much. Site Savers, the End Fund, USAID, GiveWell, the Church of Jesus Christ of Latter-day Saints, and the Nigerian government. As our co-founder once said, "Alone we can do so little. Together we can do so much."